have two of my favorite patients, Miss Elaine and Mr. Lawrence, here today. Miss Elaine has just completed her Vertiflex procedure, and I'll tell you, Miss Elaine's story is very difficult, touching, and hopefully inspiring for many. But she's been through a tough time where she had uncontrollable shaking in her legs for quite some time, years actually. And we've tried epidural shots. We thought it was coming from the spine. Then we kind of went to a neurologist. Neurologist worked her up. She's seen an orthopedist. She's seen multiple specialists. And we've kind of come full circle a few months ago and looked at the imaging again and said maybe this is all due to stenosis of the spine. So ultimately we did the procedure for her, the Vertiflex procedure, minimally invasive, and tried to open up the spinal canal at L4, L5 to let those nerves breathe again. And while we know that we can't get Miss Elaine up and moving and jogging again, I mean, she is a young 83. All right, I gave you too many years there. We know we can't get up and do the jogging again, but we want to give her the strength to stand up and hopefully work with physical therapy again. Yeah. Tell us about the results after the Vertiflex procedure. I know it's only been a little bit of time now, but tell us, and Mr. Lawrence, you can fill us in too.
Yeah, I had the procedure and I went through very well. They did a good job. And I've had no problem, no pain. And here I am again to have them help.
We're here to help you for sure. The procedure itself, just tell us, did you recover pretty quickly after it? It was
yes.
Good. Yes. Not a whole lot of pain. It was a small incision. Tell us about that.
I've changed the bandage every day for the last 5-6 days. And there was only the very first day, there was a little bit of blood. That was it. There's no blood at all. The staples kept it closed and good. She's had no pain. We tried walking a couple days ago with the walker, and she did really good. And then yesterday we had a therapist come to the house and walked her up and down and did different exercises, and she did very well. And we didn't have that crashing problem that we had prior to the procedure. She's been in the hospital many times from falling, splitting the head open, and so forth.
I know. She's had a rough time, and that's why our hope is that we don't have those kind of falls anymore. Obviously, using the walker, all those things are going to help, but the goal here is to give you just enough strength to kind of stabilize and hopefully less of those shaking episodes. Well, look, I'm glad it went well, and what we're going to do is we're going to keep checking on you, month to month to make sure we continue to follow that same path, okay?
Which is very, very good.
Thank you. You've been a great patient too, and
well, I needed help, and you were the only one that helped.
Yeah, that's sweet. We're here for you always. Okay. Good. And Joe, now what we're gonna do.